So tell me about cosmetic dentistry, smile makeovers. You do a lot of this in your practice.
I do. And so actually in my practice, we'll often tell you that there's a difference between cosmetic dentistry and aesthetic dentistry. Cosmetic dentistry is for someone who says, you know, I don't like what I see. I want to change what I see, like putting makeup on, right? So
okay.
I want to.
So they have pretty good teeth, but they just want to pick it up a notch.
They may or may not, but
okay.
they want to. They're pursuing a drastic change. Aesthetic dentistry might be someone who, you know, doesn't have perfect teeth, has a 1 or a 2 tooth problem, but they're not looking to do everything in their mouth.
Okay.
And so, you know, the aesthetic approach is to maybe replace that 1 tooth in a way that looks like the neighboring teeth. So not everything needs to come out white if the rest of your teeth are not white. A lot of people have little flecks of color, whites and yellows and browns and oranges, colors that you wouldn't imagine are in a lot of teeth, but they are. And so we use special cameras and special imaging to actually look through the tooth and to actually pick up all of these different colors and that nuance so that when the end result is produced for you, it should look like your natural teeth. It should be indistinguishable from nature.
How much is art and how much is science when you're doing like a porcelain veneer or some of these things?
Sure, I'd say it's probably 100% art and 100% science, Randy. It's a blend of all of that. And so if you take the art out of it and you look at it as just science, you're going to end up with I don't know. Things could be healthy, but if it doesn't look like teeth when all is said and done, you know, that's just not going to work for you. And if we only focus on the art and we don't actually take care of the health of your teeth, the health of your tissue,
okay.
If we're not taking care of the way your teeth work, they have a job to do. They need to chew your food. They need to function. They're not just wall art. They're to look nice for you. And so we need to make sure that they look right, that they look good to you, because you're the owner. You get to take them home when all is said and done. But we need to make sure they do the job that they're meant to do as well.
And I've looked at a lot of your photos, and it's great work. And you said you place a high importance on the lab.
Absolutely.
That you're using to make these teeth look real. Tell me about that.
So yes, the laboratory technicians that I work with are truly the best of the best. And my wife and I, we have flown the country actually seeking out the most talented laboratory artists that we can find. And so a couple of times a year, we might actually fly or travel to some of our labs, working with some of the technicians we work most closely with, sometimes sourcing and accessing, you know, some very talented artists. So you want to make sure that if you're getting this kind of dentistry done, that the doctor that you're working with is using great labs, because the doctor can be great, but if they're not able to communicate what you want, and to understand what you want and to relay that to another party, the artist, to create what everyone wants here, then things are going to be missing and it's going to show up in the end. And so we've worked hard to find people who are not only talented artists, but people who also are good listeners, and that they take our direction, so that when I say, I know what you can do, I want it to look like this. I need my artist who's working with me to take my artistic direction to actually produce what I've asked for, rather than make what they might be accustomed to making for other dentists.
So these teeth look real. Like even another dentist at first sight would say, that looks like a regular tooth.
And so I would love for anyone to take a look at my website, and what I usually say is look at my before and after photos and look as closely as you want. You know, my patients, our goal is not for you to have a 10-foot paint job where you have to stand this far away to say, yeah, it looks pretty good. Okay. You know, get as close as you want. It should look real all the way up to the max.
Do people tell you you're a perfectionist?
People tell me I'm a perfectionist all the time. Yeah, I'm obsessive about the details in a good way. Dentistry is my artistic outlet. I love what I do. I love what we produce for our patients. I love changing people's lives. I love doing things for people that they didn't know was even possible until we had a conversation about, you know, what can be done. Maybe sitting them down and looking through my book in the office and having someone say, you know, I'll bet you've never seen something like this before. You know, I can usually flip them right to the page where I say, let me find the person that looks just like you in my book.
Oh yeah.
And let me show you where they started, and they started in this chair with this appointment, saying the same thing. You know, I don't know if this can be done for me. And here they are in the end, and I can put you in version 2 and version 3 of the book. Version 2 is already in publication, but you know, we're accepting applications for version 3.